Welcome to The Explainer. Okay, so you're nearing your due date and you've probably got a million things on your mind. But then your provider tells you your baby is breech. What does that even mean? Today, we're going to break down a procedure you might have heard about called the external cephalic version, or ECV. So if you're in that final stretch and you've just learned your baby is hanging out feet first or bottom first, you're probably scrambling to figure out what's next. That term, ECV, might have been thrown around, and you're here to understand exactly what the deal is with it.
All right, let's just dive right in. What is an ECV, really? Let's get a clear picture of what this procedure actually involves. To put it simply, it's a hands-on attempt by your doctor to literally turn your baby from the outside of your belly. They recommend doing this around 36 to 37 weeks. That's kind of the sweet spot. The baby is developed enough, but there might still be just enough room in there for them to do a little flip.
Now, this isn't something that just happens in your regular checkup room. No, this is done in a hospital, and for a really good reason. They keep a super close eye on your baby the whole time, before, during, and after, using ultrasound and heart rate monitors. That constant monitoring is absolutely key for safety. So, you're probably wondering, what does it feel like? Well, this is where everyone's story is a little different. For some people, it's just a really intense, kind of weird pressure. For others, it can be pretty uncomfortable, or, even painful. It really just depends on you, the baby's position, and the provider's technique. Okay, let's get to the question that's on everyone's mind. Does this thing actually work? Let's take a look at the numbers. According to the American College of Obstetricians and Gynecologists, an ECV works for about 58% of first-time moms. The odds get a little better if you've had a baby before. So, it's better than a coin flip, but it is definitely not a sure thing. But here's something that's so important to remember. Even if the ECV is successful, it doesn't really answer the question of why your baby was breeched to begin with. You see, a baby's position is almost never random, which means even after a successful turn, some babies will just flip right back to where they were.
So, what could be causing it? Honestly, it could be a number of things. Maybe it's the unique shape of your uterus, or you have really tight pelvic muscles, or some tension in the ligaments around it. Just think of it like this. Your baby is just trying to find the coziest, most comfortable spot they possibly can in the space they've got.
And all of this brings us to a really critical conversation, weighing the pros and cons. This is not an automatic yes or no decision, so it's really important to look at both sides of the coin. On the one hand, the main benefit is pretty clear. If it works, it hugely increases your chances of a vaginal birth and avoiding a C-section. But on the flip side, there are risks. There's the discomfort, it can cause some temporary stress for the baby, and in very rare cases, more serious stuff can happen. And that right there is exactly why this is always done in a hospital. So what do you do with all this information? Well, it's really important to know that an ECV isn't your only option. It's just one of several paths you can take on this journey. And please remember this. Your baby being breeched doesn't mean your body did something wrong or your baby did something wrong. It is simply a different way for a baby to be positioned. It's not a problem to be fixed, it's just a variation of normal. So if it's normal, then what's the big deal? Well, the real challenge is often with the medical system itself. You see, over the last few decades, the skill of actually delivering a breech baby vaginally has become super rare. So now, a lot of providers are only trained to go straight to a C-section, which makes an ECV seem like the only other choice. Because of that, a lot of people start looking into other things, either instead of an ECV or alongside it. Things like prenatal chiropractic care or spinning babies techniques, they're not about forcing the baby to turn. They're about creating more balance and more space in your body, which can sometimes be all the invitation a baby needs to turn all on their own. The most important thing to take away from all this is that you are in the driver's seat here. An ECV is a valid medical tool, absolutely something to consider. But it's just one piece of the puzzle. The key is to get all the information, ask a ton of questions, and really listen to your gut about what feels right for you. At the end of the day, this decision is so personal. Whether you decide to go for the ECV, try some other things, find a provider who's skilled in vaginal breech birth, or schedule a C-section, the most powerful thing you can do is make an informed choice. One that feels right for you, your body, and your baby. So what does that next step look like for you?